How do we think differently in spine surgery? I was talking to colleagues the other day about this one procedure we do for a large herniated disc in the low back, which is called cauda-equina syndrome. And I thought, wouldn't it be kind of better to go in the front of the spine? Because the disc comes from the front and herniates to the back, which is what we do in the neck. Why not do that in the back? And we started a very good discussion about maybe some of these might be easier to treat through the front. Large herniations, people with back and leg pain, because when you go in the back, you have to pull all the nerves over to get there. So I like stirring up a little discussion to advance spine surgery. Otherwise, we're all going to keep fusing everybody's backs, which I think is heresy now. And I think we're all going to keep doing the same thing. But how do we advance the field? We have to be thinking out of the box and advance it. And that's what I try to do here. And it's all because I really want a better outcome for you. And I've had every single one of these surgeries. I've had disc replacements, front, back fusions, front, back, side, foraminotomies, front, back. I've had every spine surgery there is. So I know how it all goes, and I'm trialing you. I'm really looking out for not just you and me to get better results while preserving motion. It's so important. I hope you understand.